So it is with the Nazis and what they did to their own citizens with disabilities. I argue that their murderous blueprint has once again been activated in our current culture of death. The Nazi example makes plain that macro-political and social forces can easily be used to harm people with disabilities, but it also is an historical touchstone to inform some perceptions of disabilities now largely accepted in advanced technological societies at the dawn of our new century, such as the abortion of preborn children with identified anomalies and the proposed euthanasia of newborn or even older children, youth, and adults with disabilities. In Germany, several key societal aspects converged in what I consider to be a perfect storm that resulted eventually in the deliberate deaths of tens and perhaps hundreds of thousands of people with disabilities. Among the primary aspects of this storm of death were the role of science, the power of ideas, the convergence of macro-social conditions, the complicity of the medical profession, and the role of propaganda. The role of science. Nazi ideology legitimized itself through the pseudoscience of social Darwinism, which was then used as an instrument of deceit to perpetuate murder. On one hand, the appeal to quote-unquote science allowed the willing German intelligentsia to be more easily convinced to support and participate in brutality masquerading as research. On the other hand, the claims of social Darwinism fed the public's long-held distrust of those who were different, including people with disabilities. The enchantment of the intelligentsia with pseudoscience and the willingness of the public to see pseudoscientific claims as legitimate knowledge remain problematic today. For example, there is ample evidence that children with Down syndrome can live productive and participatory lives. But in most instances where Down syndrome is detected in utero, the overwhelming medical advice is to abort because of the child's potential future medical issues and supposed quality of life challenges. Further, even relatively minor and absolutely correctable birth defects, such as cleft palate, are now perceived as justification for termination of pregnancy. The power of ideas. The Nazi animus toward people with disabilities demonstrates the power of ideas and their consequences in the real world. In Nazi Germany, harshly prejudicial ideas towards people with disabilities replaced other, less extreme ideas. The idea of eugenics, for example, was quickly co-opted for nefarious ends. What made the idea of eugenics dangerous to people with disabilities was how the idea propelled action with scant regard for decency and compassion. In the marketplace of ideas, eugenics was embraced largely because it served a wider prejudicial purpose, namely to control and then rid Germany of people deemed different, inferior, and asocial. The minority who resisted were soon silenced in a tidal wave of demand for conformity to a master race superior to all others. Other less lethal ideas could have been adopted. For example, energy could have been directed at renewed efforts to understand deviant behavior, especially behavior resulting from and characteristics of people with emotional, physical, and intellectual disabilities. In current terms, there is ample evidence of the culture of death co-opting ideas which in and of themselves may have greater or lesser value as a philosophical debate, but which raise serious concerns about significantly negative real-world implications. For example, the quality of life argument is often raised as justification for abortion-assisted suicide or euthanasia, especially among those with severe and profound disabilities. The argument for death over suffering is powerful indeed, yet perhaps not as convincing as the general public seems to believe it is. The quality of life standard almost always ignores the many scientific advances that make the sequelae of many disabilities much more manageable than the culture of death would have us believe. Convergence of conditions. Political, intellectual, and social conditions were ripe in the late 1930s in Germany to translate what until then had been a debate over theoretical ideas into practical action. Mass forced sterilization, for example, would have been less likely had it not had the support of the government, medical, and other science professionals, and at least by their massive silence, the German public. The official act of sterilization, therefore, fused perception of difference, irrational optimism over the possibilities of genetics, a pressing need to curtail inappropriate social behavior, and the willingness to destroy the differences of people with physical, emotional, and intellectual disabilities. resulting in a powerful justification for action taken against those perceived as different. There can be little doubt that today, macro-social conditions are arranged in ways that have profound implications for people with disabilities. On one hand, the level and quality of services provided to people with disabilities is perhaps higher than at any other time in history, as is society's acceptance of physical, emotional, and intellectual difference. However, it is equally apparent that perceptions of people with disabilities, especially those with severe and profound disabilities, are increasingly being framed by their societal and economic worth. Clearly, the worth of people with disabilities is central to important debates around abortion, stem cell research, assisted suicide, and euthanasia. Rapid advances in genetic and other medical research have ascribed new and different notions of worth, not always positively, to people with disabilities. Thus, the general social acceptance of abortion, medical biases against those diagnosed as disabled in utero, and the general public's unquestioning acceptance of the quality of life standard together combine to produce a potentially life-threatening social context for many people. Abortion of children with disability relates to even broader biomedical issues, such as organ harvesting. It is not unreasonable to posit that coupling the undesirability of some in utero condition might lead to abortion and to certain parts of that same unborn child being used for other uses. In terms of euthanasia, notions of the economic worth of people with disabilities, such as those espoused by Peter Singer, already well known, are hard to miss. In some, Singer calls for a radical reassessment of what to do with children born with severe and profound disabilities. Largely through quality of life arguments and utilitarian arguments, Singer suggests that the value and fate of newly born children with severe disabilities should be decided according to the child's potential communal worth, including the child's economic worth. That is, whether the child is allowed to live or not is completely dependent on the parents' and community's judgment of the child's potential to serve that community, rather than the child having a right to exist by having been born. As with Binding and Hosch in 1920s Germany, this shifts the burden of being allowed to live from the act of involuntarily existing to justification for existing based on social usefulness. Also, I might add that in my area of expertise, special education, my colleagues and our learned organizations have been almost completely silent on this issue. Shame on them. At the opposite end of the lifespan, recent developments in the US and Europe are changing the voluntary nature of a quote-unquote gentle death still further, also based in part, I think, on economic worth. In the best-known example mentioned many times at this conference, Oregon voters have not only designated the power of the state to support physician-assisted suicide, but have also assigned economic value to who should and who should not receive expensive health care via its Medicaid health care rationing. Oregon law, for example, specifies denial of treatment to some late-stage terminal illnesses and very low birth weight infants. The Oregon example clearly shows a shift from compassion and ethical obligation to treating individuals to a more dangerously practical medicine based on collective economic viability. Nor are these issues confined to the U.S. The Dutch idea of euthanasia, as we've talked about many times, as a citizen's right, thereby legally absolving physicians from criminality, is an unsubtle, in my opinion, reincarnation of Nazi Dr. Victor Brock's ghoulish notion, and I quote, "The needle belongs in the hand of the doctor." In Oregon, the Netherlands, and elsewhere, the state has become an arbiter of decisions about life and death for its citizens, including, and I would argue especially, about persons with disabilities. The complicity of the medical professions. It is important to note that the enactment of prejudice against people with disabilities in Nazi Germany could not have succeeded without complicity of the medical professions.